everybody, it's Dr. Tracy Papa, and today we're going to talk about a subject that I know every pregnant woman is very interested in, and that's what happens when you have your ultrasound. No matter where you are in your pregnancy or how far along, this is something that is an important day that nobody wants to miss. Some people in my office just come by themselves. Some bring so many family members that I think we are going to have to set up bleachers. But today, Catherine, one of our lead sonographers, is going to talk about what happens when you have your ultrasound. She'll talk about what she's looking at and what we're looking for so that you'll have a little bit better idea of what to expect when you go in to have your ultrasound.
Hi everyone, I'm Catherine. I'm going to be the sonographer today to help you out to figure out how you need to scan the patient. So this is our patient Tiffany here. We're going to be scanning her baby today. So first we're going to be taking a look at cervix, ovaries, we're going to take a look at placenta and where the baby's lying. We look at these things first to assess any risk, if your cervix is closed, open, if we need to do any extra assessment for the physician. We'll also look at your ovaries, so there's going to be a lot of imaging that may not be the baby at first. We have to look at these things so we can make sure that everything is normal for the physician to see, that they don't need to look at ovarian cyst, or if the cervix is opening, we may need to do a transvaginal exam. So just be prepared for the first 3 to 5 minutes of the exam won't be your baby, okay? So I'm going to go ahead and start. The baby is laying cephalic, so I'm going to start from head to toes to get that anatomy and look at all the baby parts and make sure that everything looks okay for the doctor, okay? So first we got the head here. I'm just going to sweep up. We want to look at baby's stomach, baby's beautiful heart there pumping. You see the arms. You get baby's little face while we're up here. We just look at everything in a sort of sequence for when the doctor looks at this exam. It's not jumping all around. So there are certain parts like the brain and the heart that we may really focus on. We may not talk to you during this exam while we look at the heart and the brain, but that's because we really want to look in detail to make sure we're not being distracted and we can get all the images that we need for your baby, okay? Please understand whenever you ask the sonographer questions like, what am I looking at? What are you looking at? What are you measuring? We can answer simple questions like that, like I'm looking at the heart, or I'm going to measure baby's leg here. However, we will not be able to answer diagnostic questions, as in, is something wrong with my baby's heart? Or if something was abnormal previously and a patient asks us, well, how does that look today? Unfortunately, we will be unable to answer that for you. So please know it is not because we don't want to tell you or because something is wrong. We just have to wait for the doctor to be able to give you those answers. During the exam, the sonographer may ask you multiple times if you're feeling okay laying on your back. There's a reason for this. Whenever you lay on your back, the weight of the baby may squish some of the vessels behind you. It's called the aorta and the inferior vena cava. So the inferior vena cava is very elastic, and sometimes the weight of the baby may just kind of push that down a little bit, and it'll make you feel nauseous, it'll make you be dizzy, and you may feel a little hot. So we want to be aware and make sure that you are not going to, be uncomfortable during the exam. Moms always expect to be able to get the greatest pictures for every ultrasound that they come in. Unfortunately, we are at the mercy of the baby. If the baby is looking down at your spine, if the baby has hands over his or her face, or just so curled up, we're not going to be able to get the best picture. Also, what impacts this is gestational age. If you have a really young baby, we may not get the greatest pictures as later in the pregnancy. As your baby grows, they get that fat on their face and it may get a little cuter. So every time you come in, I promise, the sonographer is going to do her best to get the best pictures for you. As you come into these different exams, each exam we do is going to be a different time frame. As you come in for early, like a first trimester, we're doing a couple measurements on your baby from bottom to head. We're going to check the heart rate and just make sure we can get some cute pictures for you too in that first trimester. As your baby gets older, it's called a screening exam. That is going to be a very long exam. Sometimes it can take 45 to 60 minutes depending on what we're looking at. So if you feel anxious or that we're taking too long, please do not worry. There's like 120 pictures sometimes we have to get during these exams, so it takes a little bit. Please just be mindful. If you need to go to the restroom, tell us you need to take a break. We'll take a break whenever you want to. You will get the results from the doctor for this exam, so as we scan you, it may be taking too long. Just don't be anxious. Just relax, enjoy your baby, and you'll get your answers that you need from the physician. As your baby gets older, and after the screening exam, we're going to do things called a follow-up growth, where we're just getting baby's measurements. This is not going to take as long as the full screening exam. So this may not be as long as exam as you were expecting, and you may have thought, why did that sonographer go so quickly? It's not that she's rushing through your exam, it's just not as many pictures. To compare it, it's probably about 40 to 50 pictures depending on what anatomy we need to finish up that wasn't seen at the screening, or if everything has been seen before and we just need to get measurements and a few things of baby's anatomy. So it may not take as long as you were probably expecting. And again, as your baby gets older, we're going to do what's called biophysicals sometimes, depending on your indications. These biophysicals, we're looking for baby stretching, moving those arms and legs, moving that body, rolling the head, and also what's called practice breathing. So this baby has to do all these sequence of movements and practice breathing before we can end the exam. Sometimes your baby's doing everything immediately, and it only takes a short few minutes. And that is why these exams later in pregnancy don't take as long as whenever we see you for your screening. So please, don't be anxious, just enjoy the exam and you'll get all your results from the physician. During the exam, you may think of things that you forgot to tell the medical assistant or the nurse or the student, whoever checked you in that day. If you're laying here and enjoying the ultrasound, if you think of something like, oh, I haven't been feeling my baby move very much, or I'm having a little bit of pain down here on my lower side, feel free to bring that up to us, whatever we need to bring up to the physician or to the medical assistant or the nurse. We will do that for you. So anything that you forget about, please bring it up and we will make sure that it gets to the correct person.
Remember that when you have an ultrasound in your OB provider's office, it may just be an ultrasound appointment, and you may come and go from the office and the doctor may not come in. When you're in the maternal fetal medicine office, you're here for a reason, because there's a concern about your baby. So every time a provider will come in and we will go over the ultrasound images and we will answer your questions for you. So rest assured that anything you've been saving that the sonographer couldn't answer, I'll answer when I come in. That was a lot of fun, and ultrasound should be informative and fun if everything is going well with your baby. Don't forget that sometimes we may ask you to come back if there's something we need a better look at or we want to follow up on the baby's growth. Also, try not to be disappointed if we can't get every image that looks like it came out of a photo shoot from a magazine. Every baby is a little bit different, and sometimes they cooperate and sometimes they don't. If you want more updates and great content like this, don't forget to visit me at my website, drtracypapa.com, and fill in your email address, and I'll send you something every week.